You ever get that weird, nagging, maybe even sharp pain in your lower right side, and you just think, what in the world is that? Well, you're not alone. It's a super common thing to worry about, so let's dive in and try to decode what that pain might be telling you.
Right? This is the big question. That feeling can be anything from a tiny annoyance to something that really makes you worry. So in this explainer, we're going to break down the most likely causes, just so you have a better handle on what might be going on in there.
All right, here's our game plan. First, we'll get familiar with what's actually in that part of your body. Then, we'll talk about the usual suspects, the common, less scary causes. After that, we'll look at issues specific to males and females, cover the really serious red flag symptoms you need to know, and wrap it all up with a clear action plan.
Okay, Section 1, that mysterious abdominal pain. Look, before we can figure out the why, we've got to understand the where. So what's actually going on in that neighborhood?
And you know what? Let's start with a little bit of good news, right off the bat. Most of the time, this kind of pain is temporary. It's nothing serious, and it usually goes away in a day or two all by itself. So let's just take a breath and start from a place of information, not anxiety. So, what are we actually talking about here? Your lower right abdomen is some pretty prime real estate. It's home to your appendix, parts of both your small and large intestines, a urine duct, and for females, the right ovary. I mean, with that much going on in one little spot, it kind of makes sense that there are a bunch of different reasons you might feel some discomfort. Which brings us to Section 2, the common culprits. Now we're going to get into the things that are most likely causing that ache or pain, and thankfully, these are usually the least serious ones. First up, good old indigestion. I think we've all been there, right? That really uncomfortable feeling after you eat or drink something that just doesn't agree with you. And yet, you usually feel it higher up, but that pain can definitely travel downwards and feel sharp, dull, or even like a burning sensation. And then there's gas. It's simple, really. Your body's breaking down food, and sometimes a little air gets trapped. It can cause bloating and that classic knotted stomach feeling. And, the solution is usually pretty natural.
And speaking of natural relief, get ready for this number, 30. Yep, that's roughly how many times a day it's considered totally normal for a person to belch. So hey, while it might not be the most polite thing in the world, it's just your body doing its job.
Okay, next up is Irritable Bowel Syndrome. You've probably heard of it as IBS. Now, this isn't just a one-off thing. It's a long-term condition that messes with your digestive system. It's famous for causing a whole bunch of symptoms, including the exact kind of stomach cramps we're talking about.
And just look at how common IBS is. Seriously, these numbers are wild. Somewhere between 17 and 24% of Americans are dealing with it. That's almost 1 in 4 people. So if you have it, you are definitely not alone.
Okay, on to our third section, gender-specific causes. It makes sense, right? Because of some key anatomical differences, there are a few conditions that cause this specific pain that only affect biological males or females.
So here's a quick little side-by-side view. For females, we're thinking about things like menstrual cramps, ovarian cysts, or something serious like an ectopic pregnancy. For males, we're looking at things like inguinal hernias or testicular torsion. Let's dig into these a bit more. For females, the possibilities range from something as common as menstrual cramps to more complex issues like endometriosis or ovarian cysts. But I really want you to focus on the last two here, ectopic pregnancy and ovarian torsion. These are not things to mess around with. Both are considered medical emergencies and need immediate medical help. Now for the fellas, a very common cause is what's called an inguinal hernia. That's just when a bit of your intestine pokes through a weak spot in your abdominal muscle. But the other big one is testicular torsion. This one is extremely serious. It literally cuts off the blood flow and is a major medical emergency that almost always requires surgery, and fast.
Okay, so this brings us to Section 4, and we're going to shift gears a bit. The tone gets more serious here because we absolutely have to talk about the red flags, the symptoms that are basically your body screaming that this isn't just a simple stomachache.
And the most famous, or maybe infamous, cause of lower right abdominal pain is, of course, appendicitis. This is when your appendix gets all inflamed and infected. The single most important thing to know is that this is not a wait-and-see kind of deal. If your appendix bursts, it can be life-threatening. And here's a really key description of what that pain feels like. It's a pain that can come on all of a sudden and gets worse when you do simple things like move or even just take a breath. That specific detail, pain getting worse with movement, is a huge sign to watch out for. Now, besides appendicitis, there are other serious things it could be. Kidney stones can cause some of the worst pain a person can experience. A kidney infection can cause pain in your abdomen, sure, but also your back or sides. And like we said before, a hernia can get strangulated, cutting off blood flow to that tissue, which is a big-time emergency.
So, with all this information swirling around, how in the world do you know, how do you make that call between, I'll just wait it out, and, okay, we need to go to the emergency room right now?
Well, that leads us perfectly into our last and honestly most important section, your decisive action plan. This is where we turn all that information into clear, confident steps you can take.
Think of this as your non-negotiable checklist. If you have that abdominal pain and you have any of these other symptoms, sudden, really bad pain, a fever, it's super tender when you just touch the area, you see blood in your vomit or your stool, you can't stop feeling sick and throwing up, or your skin or eyes look yellowish, you need to get medical help immediately. Don't wait. Don't second-guess it. Just go.
So here's the bottom line, the main takeaway from all of this. Mild pain, from gas or something you ate, you can often handle that at home, and it'll probably pass. But pain that is severe, that comes out of nowhere, or that sticks around for more than a couple of days, that is your body telling you it's time to call a doctor.
Look, at the end of the day, learning about all this stuff isn't so you can diagnose yourself on the internet. It's about being a better, smarter advocate for your own health. So the real question is, do you feel a little more equipped now to really listen to what your body is trying to tell you?